Welcome to Dr. O Ozone Bio Research Group. My name is Oleg Nikishin, and in this video I will show you how to set up your syringes and your therapy kits for ozone rectal vaginal insufflation. But first thing first, I have to do the disclosure. Please take a few minutes to read the disclosure and OSHA safety and requirements. In Dr. O Solutions, we designed two rectal vaginal kits, variation number 1 and variation number 2. They are a little bit different and designed differently, but let me tell you what those kits contain. Kit variation number 1, it contains small syringe. Syringe has medical silicone ozone resistant plunger. It comes with a small extension, 2 feet extension. It comes with ozone insufflation bag with a lure connector, and it comes with 5 interchangeable catheters. Variation number 2, it comes with a large syringe, 140 cc syringe. Syringe has ozone silicone resistant plunger. It has shut-off valve that connects directly to syringe. It comes with a 1 meter extension that connects directly to syringe, and it comes with the 3 exchangeable catheters with a lure lock connector. So ozone generator has a female lure connector on the top of generator. So the syringes in the bag connects directly to the female lure connector. Okay, let's start with variation number 2. But we do have 10 pack catheters. If you use the catheters that's already in the kit, so you can buy separately. They come in a 10 pack, and as you can see, it comes with the lure connector. Okay, next slide, please. Okay, here is a chart for you, the same chart we have on a ozone generator. Okay, but let's continue, and I will explain you why do we have 2 different kits. As you can see, as I explained it to you, the kit number 1, variation number 1, comes with a small syringe and a bag, and the kit number 2 comes with a simply large syringe. Variation number 1. So first, if you've never done rectal or vaginal insufflation, you need to start slowly. That's why we enclose a small syringe, 50 cc syringe. Because if you've never done it before and you start doing it, you're going to provoke immune response, and most likely you're going to have a healing reaction. That's why you're going to start slowly. We usually recommend starting with a 40 to 50, not more than 50 cc from first maybe 3-5 insufflations, and that depends how you feel and what your condition is. Obviously, the best way is contact your health professional that you're working with, or contact us for training, for explanation how you can do it in your particular condition, or in your particular disorder, or simply your health issue. So you'll start slowly with the 40-50, and we usually recommend, but again, it's every customer and patient, every condition is different, but we recommend setting up on the 1/8 liter flow per minute, 57 gamma. So you do once, you do twice insufflation. Usually people do it every second day. But first, we do have cleansing enema, and this is extremely important. We have a few calls that people have been complaining that they have a toxic reaction. When I ask them, did you do cleansing enema first? And the answer was no, no one told me. So we have in the manual, every kit comes with a manual, and it's stated in the manual, please do cleansing enema first. The reason that for that cleansing, your colon lining is very toxic. If you've never done enema or colonic irrigation before, your colon lining has a lot of toxicity built into it. And when you do ozone insufflation, ozone is going to oxidize that toxin, and that there is a good chance of that toxicity is going to hit your blood vessels and hit your systemic circulation, and you're going to have a healing reaction and toxicity reaction. So if you've never done colon irrigation, as I said, or enema cleansing, I even recommend you do first 2 irrigations every day in a row, maybe 2 or 3. Make sure your colon is clean, and then before doing rectal or vaginal insufflation, you do cleansing enema again, but your colon lining will be already much cleaner. Then you do the rectal insufflation. I did not cover yet vaginal insufflation, and the reason being is rectal insufflation is most popular. Vaginal insufflation is not that popular, and procedures are the same. You're just going to use more volume per vaginal insufflation than rectal insufflation. Second, vaginal insufflation, most of the time, it's not systemic blood cleansing procedure, it's lymphatic cleansing procedure. So vaginal insufflation cleans your lymphatic system. Okay, and let's go back to rectal insufflation. Okay, so rectal insufflation, when you do the insufflation, your ozone is going to go through the colon lining and going to hit your bloodstream. So for that reason, your body is going to use ozone almost immediately. Ozone is going to be converted by your enzymatic reaction to the water and provoke new enzymatic reaction that provokes the healing, and it will activate your white blood cells, especially will activate your T cells, which is extremely important in the cancer cases. So your colon, assuming you're empty, you did cleansing, then you're gonna inject ozone in the rectum, and your rectum already has the air pockets and air in it. That's why I'm not a big fan of insufflating large volume of ozone in the colon, because it's going to provoke the cramping. So your colon is going to squeeze back this air. You're going to have some pain, some reaction of cramping, some reaction of stinging you, and that's why we do not recommend insufflating the large volume. That's why you have a high concentration, 57 gamma, then you use that 40-50 cc from the beginning. You insufflate on your colon, and that ozone mixture will mix into the air already in the colon, and concentration will be reduced substantially. And it will be probably, we tested once, it was probably about 20 gamma, which is a perfect. 20 to 35 gamma, it's kind of nice healing, not too active, not too diluted concentration of ozone. Okay. Let's continue for physical procedure, how you do that. So for instance, we start with a small syringe, and it has extension. Why we have extension? Obviously you have some flexible people, they can reach immediately down and insufflate right away, because our, give me a second, here we go, our catheter, it connects directly to syringe. It's a lure, male-female, goes right in, and it's ready to use. But as I said, there are some inflexible people, I understand, that's why we have extension. Extension goes directly to syringe, and lure male goes to lure female of catheter, and so you can reach it pretty much very easy down on the rear. Okay, or in vagina in the case of female patient. That's why we have this. Okay, so let's continue. This is bag we'll cover a little bit later. Okay, we set up the tank at 1/8 liter per minute. And by the way, make sure you use oxygen filters. If it's industrial tank or medical tank, they all have built-in residue inside. Aluminum tank has aluminum oxide. We notice it has like grayish residue coming out of the tank. If it's industrial tank, you're going to have some rust inside, so make sure you use oxygen filters and you use them periodically. So we open up the top of the valve of the tank, set up 1/8 liter per minute. That's 57 gamma, and it's coming out from, now coming out from the port, top ozone port. So this is very slow feed, so even ozone is coming, but I even can't smell it because it's such a small feed. So what you do, you set up your syringe. As soon as it's tight, here you go, it starts coming right up. Okay, I will let it fill till 40 cc's. Okay, and shut off right there on the end. Okay, there is excessive. I would recommend you just to fill up a little bit more, just like that. And I'll explain in a minute why. Okay, here we go. That's fine. So we're gonna use 40 cc's. So ozone stays inside, no problem. Ozone is heavy gas, there is no outlet, so ozone is staying inside. There is no problem at all. So here is, we have a syringe, full syringe, 50 plus cc's ozone inside. Okay, as you can see, so ozone is flowing, and there is some slight pressure building up, and putting the pressure against the plunger, and plunger going up. Okay, by the way, the few notes. We have quite a few complaints, so to speak. It's not complaint, it's simply people do not understand why syringe plunger is not going up. I just showed you when syringe is not tightly connected to the top, there is this tiny leak cause ozone to leak and not pushing syringe up. That's the main and only reason for it. Okay, we attach extension, and what we're gonna do, so since we need the 40 cc's and we have some air in a line, what we do, we simply squeeze a little, and now we push the air and leave 42 because about 2 cc's in a line. So now ozone filled whole this line up to the catheter. So, and that is ready to use. Okay, so this is, we have 40 cc's, so you lubricate it, put it in your rectum, and slowly squeeze it. There is not so much volume, you're barely going to feel it. So it's simply small, very sweet. When the concentration low, it's very sweet, sweet smell of ozone. Okay, that's about the small first time insufflation, small syringe for first few insufflations. Again, we recommend you do maybe once or twice or 3 times a small insufflation, see how you feel. I guarantee you're going to have a healing reaction. When you have a healing reaction, do not do any insufflation. I know if you wanted to, you have a cancer, you're feeling like I want to go right into it, I want to have a treatment, I can't wait, I need to have more. No, don't do that. Stop at this point, because ozone, and as it says in the manual, I put it in the manual, ozone, more it's not better. So that's just remember, more ozone is not better. You will provoke your healing reaction, activate your white blood cells, and you're going to have a whole healing coming forward in you. Okay. Now, if you've done that, what we can do, we recommend you dip your syringe in a regular hydrogen peroxide, H2O2, so you can connect it back and flush it with the hydrogen peroxide, and pretty much is going to disinfect, even though ozone does have all disinfection by itself, but still you're going to have some buildups. Okay, that's about small syringe. Yes, now let's go to the bag. Here is a bag, ozone insufflation bag. It connects directly to ozone on top of lure connector on ozone generator. And the bag has 3 compartments. 200, 400 and 750 cc's, milliliters. Okay, here it does the show of ozone, but I personally do not go by it. Just go by your manual, because it's all been proven in the manual. We do have it in the clinic. So the minimum you can do is 200 cc. Again, this 200 cc is quite a volume. And 400 and 700 you're probably gonna use only for vaginal insufflation, because insufflate yourself with such a large volume, it's not that easy for your body, and you're gonna have some pain in the colon. That's what I just covered before. So I do a very simple trick. Here is a paper clip, the regular paper clip, and there is a pinch. It says pinch it here. So what I do is very simple. I just put the paper clip over it, just like that. And you will see it will work. So it's almost procedures is the same. So we put in 1/8 liter per minute. Now it's coming out. So that some air has to escape. We just put lure connector in the weight. Since the volume, the flow of the oxygen is too slow, it's only 1/8 liter per minute. So as you can see, this is 200 cc's. It's gonna take a few minutes to fill up this portion of the bag. And you can see now it's inflating. This doesn't inflate, but this does. Okay. So now we have a balloon. Start ballooning. Okay. As soon as it's all the way up, it's almost not there yet. Shut up the feet. Don't shut the top of the valve. Shut off the knob, because knob shuts off almost completely. Just a few psi's pushing it back. So now, as you can see, it's full. So what you do, you squeeze it, the thumb knob, the thumb lock, and it's ready to use. Okay. So you attach catheters to it. That goes directly to the bag, and you pretty much you will probably do. You just will take the paper clip out. Make sure you don't punch the bag, and slowly just roll it and squeeze it. Okay, obviously this piece will be in your vagina or rectal. Okay, I can smell this very sweet smell of ozone. That was variation number 1. Okay, let's go back to variation number 2. Vaginal rectal kit variation number 2. Variation number 2 comes with one single large syringe. And we've been asked to design that kit because many of our customers do not use a bag, or they do say bag is not that handy, you have to replace it. This is you will replace eventually too, but it's a medical PVC, which is ozone resistant body, and medical grade silicone plunger. So it almost will not deteriorate maybe for more than a year. Okay. The procedure is the same, but let me first cover it. Small difference. We didn't close the small shut-off valve, plastic shut-off valve. Why we do that? Because this is lure connector on the top of generator. Is a medical stainless steel. It's very sharp, and this is still plastic, so you can easily strip it. If you strip it, you're never gonna fill up the syringe. You have to dispose it. That's why we enclosed the shut-off valve, because this is attaches to top and stay attached. So now you have two mating connections, plastic to plastic, and this protects the male lure connector on the end of syringe. Procedure is the same. Let's set it up for 1.8 liter per minute. So now the oxygen is flowing. You start ozone generator. So make sure it's freely moving. No need to lubricate it. Many people do. They call us, but they say it makes no difference to us. So connect syringe to it. See, you can start flowing right away. It's very tight connection, not over tight, nothing stripped, but you can see it's flowing nicely, filling up nicely. Even syringe, it feels like tight, but it has enough pressure. It doesn't have excessive amount of pressure, but does have enough pressure to push plunger out. Let's assume we did the job. It's up to what? Well, let's fill up to 100. That's what your next step will be. So I'll cover 40, 50. Next step will be for you 100. So as soon as it reaches about 100, I'm going to shut it off. It has excessive pressure, it's going to escape, and now it's ready to use. Don't worry, it's not going to escape back, because Ozone generator has a one-way valve built into it. So now we hold this shut-off valve, open up syringe, and now it has ozone inside. So the ozone stays inside, it's not going to leak out, don't worry about it. So it's ready to be insufflated and be used. So again, if you're flexible enough, you can connect your catheters directly to syringe. Well, I still prefer using extension. You use extension, and this goes in the end of extension. Okay, now it's ready. We have some excess air inside, that's why we have to squeeze a little. I don't want air in the column, but it's not that much of a difference, but still I want to have be precise. Now it's ready to be insufflated in the rectum or in vagina. And procedure is the same. You lubricate the end of the catheter, you insert in your rectum, and you simply slowly squeeze your plunger. You're pulling out, you do this, you fill up with hydrogen peroxide or washing solution, whatever you like. The soap solution works fine too, and just wash the end of the catheter. If you wish to do it with an extension or without extension, not make much of a difference. Now, okay, that's variation number 2. Okay, let me go in a little bit details. That's why you can do 40 in the large variation number 2. Then go to the, for instance, 80, then 100. Then most of you can do in this 140. 140 it's a quite large volume, believe me, and you might gonna have some reaction in your colon as well as the spams, so you're gonna have some cramping, but it's not big of a cramping as you do 200 and higher. So that's what we recommend, and I usually do not recommend more than 140 because it's very hard for your colon. That's why this variation number 2 is more universal to use, and I think it's more, that's my choice for insufflations. Okay, so I can leave this on. That's what I usually do at home and in the clinic when I use it. It's always on. It protects the equipment, and you can't even shut it off if you wish. So this is as far as the technique for doing rectal and vaginal insufflation. About vaginal insufflation, you're probably going to do more volume in it, but procedure is pretty much the same. Okay, that was, I think it was, we cover all in our vaginal rectal insufflation kits. We did not cover the biochemistry, we did not cover protocols for different disorders because it's totally different topic. It depends on your condition. Just remember, vaginal insufflation, ozone insufflation treats lymphatic system. Rectal insufflation is systemic blood ozonation. That's all the difference. Now, one more final note. When you do first insufflation, I always tell my patients and my customers, do not rush into the second one. Wait maybe 2 days, maybe 3 days. Sometimes you don't feel almost nothing at all, but in the day or two you're going to have different pains in your body. That's a healing reaction. That's what you have to wait for. Because once you do more and more and more and more, the harder it's going to get from the beginning. So wait this healing reaction. If in the 3 days you do not have any healing reactions, like fluctuating pains in your body, you will feel it. It's sometimes it appears differently as far as symptoms go. Now, go to the next insufflation in 2 or 3 days. I usually recommend 2 to 3 days. You do it again, small volume, 40, 50. At the second insufflation, wait again 2 days. See how your body reacts. Know your body. You gotta develop that feeling, what's going on with my body. Make sure you do, again, cleansing enema in between as well. If you feel like 40, 50, no problem to you, no healing reaction, I don't feel much, I feel better, I can do it like you say you do it in a week, then you're ready for the next volume. And build that volume up to 140, 150 cc's. That's my final